We've got the doctors from Desert Medical Care and Wellness. They are back to talk about back pain, something that affects us all, and how they can help you, and hopefully me. Welcome back, gentlemen. And a new face, Wayne, how you doing?
Fantastic now.
All right, I bet. And we're going to get to you in a minute. Yeah, this is actually, I'm excited to hear what you have to say.
Thank you.
Dr. Olesnicky, talk about what is your four-pillar process for back pain?
Well, we start off with addressing the thing that really tortures you, and that's the pain and then the inflammation. So inflammation is just a vicious cycle of pain, pain, pain. And every time you move, the inflammation causes more pain. It's your pain generator. So our first pillar is to look at how we can decrease your pain being generated by inflammation. So we do all sorts of things to stop the inflammation, including things called cytokines. And cytokines are actually proteins that we can push through your skin that tell your body to calm down and give me a break from the inflammation. And that's step one. And then I turn them over to Dr. Hashimoto.
Yeah, so we have a lot of new therapies in the office. One of the things that we use, like we use with Wayne, is something called pulse electromagnetic field therapy. Dr. Oz is featured on a show. It's been used in the past for healing up fractures, but they found out that it also works for pain. So it's going to increase circulation, speed up that heating cycle, and it's also going to reduce that pain cycle. And that's one of the first lines of defense that we have, and then after that, essentially, we'll do the structural thing where we'll loosen up tight muscles, tight joints, maybe decompress discs like what we did over here, and then we'll reinforce that with traditional physical therapy. And then the fourth one is the regenerative medicine. If they pass a point of no return, my partner does a lot of that in the office. And
we can use tons of different modalities with that. If you're kind of in the no man's land where things aren't working or you really need to have that extra kick, we have even stem cell transplant therapy where we can rebuild the tissue with your own little repair robots that are the stem cells, and they create the right tissue or heal the right tissue. So it's really advanced therapy. Not everybody needs it, but we have that all in our toolkit.
Fascinating.
Yeah.
Fascinating. So PEMF, is that considered good back pain? How does that correlate?
It's good for anyone that has inflammation. So it's going to work on various other joints, but back pain affects 4 out of 5 Americans. It's a very good adjunctive therapy that adds into our bag of tricks. So this is for the people. We have a lot of patients that come in like that have spinal stenosis, chronic back pain, chronic arthritis, where the epidurals and the shots aren't really quite good enough. The physical therapy, chiropractic stuff doesn't work, but they're not bad enough where they really want to do surgery yet. So we kind of really thrive in that no man's land, and that's kind of like where Wayne was living right over here. So I know Wayne wants to share what he went through.
You're up. Let's hear it, Wayne.
When I walked into that office, I could not walk. The pain was so excruciating in my back. When I walked, I literally had to lean over so that there was no pain or compression on the back. I got a CAT scan, and Dr. Hashimoto literally walked me through exactly what was going on in my back, where the disc was going up against the nerves, the sciatic nerves. Literally, I could not do anything. After the therapies, and especially this magnetic therapy that the good doctor just talked about, which is amazing. And by the way, they have all kinds of state-of-the-art equipment at their facility. Not just that, they are state-of-the-art. I can golf now. I can ride my bike now. By the way, my golf score didn't help me at all. I can swim now. I can do things that I could not do.
Yeah.
These guys are miracle workers. I have my life back. One last thing I do need to say to both of you is what they did with the hiring of the people that work for you. They care, they have compassion. You two did a heck of a job of hiring the right kinds of people at this facility. I can't thank them enough.
And this is why you do what you do, right?
Oh yeah,
I'm
no,
touched. Wayne, this is really, I'm glad you shared that with us.
God bless, thank you.
Yeah, quite nice. All right. The doctors are extending half off to our viewers. On your first visit, just make sure to watch the video about PEMF and book their appointment. The information's right there for you. 760-777-8377. A big thanks to you three for being here. And again, thanks for sharing your story, Wayne. And we'll see you after the break.
Thank you.